Hi, and welcome to Cenario, your partner in mental wellness. Here on our channel, we share educational, insightful, and science-backed content to help you understand your mental health and take meaningful steps toward a more balanced life. If you're ready to learn, grow, and take control of your wellness journey, let's jump right in.
Today we are diving into something that a lot of people face, but it can be so tough to talk about, let alone deal with. We're talking about the heavy combination of obsessive-compulsive disorder and depression. It's a real dual burden. And when you think about the fact that it can take, on average, over a decade for someone with OCD to even get the right help, well, understanding how these two are connected isn't just interesting, it's absolutely essential. So that brings us to the big question, right? Why do OCD and depression so often feel like they're tangled together? If you've ever dealt with this, you've probably felt that pull, this really strong link between the cycle of OCD and the weight of depression. Is that just a coincidence, or is there something much deeper going on? Okay, let's dig into what the research actually tells us. So here's what we're going to cover. First, we'll get the definitions straight. Then, we'll look at how OCD can actually pave the way for depression. After that, we're getting into the practical stuff. Treatment plans, the hurdles you can expect, and finally, a look at some advanced and future options. All right, first things first. Before we can untangle them, we have to know exactly what we're talking about. We need to build a really solid foundation here. Okay, so OCD. It really boils down to two main things. First, you've got obsessions. These are intrusive, unwanted thoughts or images that just pop into your head and cause a ton of distress. And then, to deal with that anxiety, come the compulsions. These are the repetitive behaviors or mental rituals you feel you have to do to get some relief. And on the other side of the coin, you have major depressive disorder or just depression. And this is so much more than just feeling sad. We're talking about a persistent, deep, low mood and a really key symptom called anhedonia. That's when you lose interest or can't find pleasure in things you used to love. It just saps your energy and messes with the basics, like sleep and appetite. Now, when you have two conditions happening at the same time, there's a clinical term for that: comorbidity. And with OCD and depression, this is not a rare thing at all. It's actually incredibly common. They show up together so often that it's a well-known clinical reality. Okay, so if they happen together a lot, does one cause the other? This is where the story gets really interesting. When you follow the evidence, a very clear pattern starts to show up. And here is the absolute key. Research overwhelmingly suggests the pathway pretty much goes one way. It's not that depression leads to OCD. It's that as OCD becomes more and more severe, more disabling, that's when depression tends to follow. The OCD creates the perfect storm for depression to set in. So how exactly does that happen? Well, it's like a domino effect. First, the compulsions can start to eat up hours and hours of your day. You can't work, you can't see friends, you become isolated. Mentally, you're just exhausted from the constant fight. Then comes the shame, a deep sense of shame about the thoughts and behaviors, which just destroys self-esteem. And finally, you might start avoiding people and places to avoid your triggers, which cuts you off from your support system right when you need it most. Now, things can get a little tricky because some of the symptoms can look really similar on the outside. Take rumination, for example. In OCD, that's usually being stuck on a very specific fear. But in depression, it's more of a general, hopeless loop about yourself and your future. The symptom looks the same, but the engine driving it is totally different. And knowing that difference is crucial for treatment. And this is why getting it right is so important. Having both disorders doesn't just add to the pain, it multiplies the risk. When OCD and depression exist together, the estimated risk for self-harm and suicide goes up by 3 to 4 times. That's a staggering number that really highlights how serious this is. Okay. So knowing that OCD is usually the one in the driver's seat, that actually gives us a huge advantage. It tells us exactly where we need to aim our treatment efforts to be most effective. And the strategy is simple but powerful. You treat the driver first. The idea is to prioritize treating the OCD because what clinicians find again and again is that as the obsessions and compulsions get better, the depression that grew out of that struggle starts to lift too. You're getting at the root of the problem. So how do you do that? The number one gold standard therapy is called exposure and response prevention, or ERP. Let's break that down. Exposure means you gradually and safely face the things that trigger your obsessions. And then the response prevention part, and this is the tough part, is learning to resist the urge to do the compulsion. It literally retrains your brain to understand that the anxiety goes away on its own, without the ritual.
Now, what about medication? Well, if SSRIs are part of the plan, there's a really important difference. For depression, standard doses can work quite well. But for OCD, you often need much higher doses, and you need to be on them for a longer time before you really see a benefit. That's a super important thing to know to manage expectations.
But, it's one thing to have a great strategy on paper. It's a whole other thing to actually put it into practice. And this is where the depression can really throw a wrench in the works. So here's the catch-22. ERP is hard work. It takes a lot of energy and motivation. And what does depression do? It robs you of those exact things. The hopelessness tells you, why bother? It won't work. And the sheer lack of energy can make facing your fears feel absolutely impossible.
So what do? Well, skilled clinicians have a whole toolkit for this. They might start with something called behavioral activation, just getting you to do small, simple things to get a little bit of momentum and lift your mood. They'll use techniques to help you find your own motivation to change. They'll break goals down into tiny, manageable steps so it doesn't feel so overwhelming. And, of course, they'll make sure the whole treatment team is on the same page.
Now, for some people, even with the best standard care, it's still not enough. For those really severe treatment-resistant cases, there are other more advanced options out there, and it's important to know about them.
So instead of going to therapy once a week, some people might need an intensive ERP program. This is like a boot camp for OCD. We're talking daily, focused therapy for several hours a day over a few weeks. It's a huge commitment for sure, but it can create a powerful momentum that's hard to get otherwise.
And then, for the most severe cases, you have neuromodulation. These are techniques that work directly on the brain circuitry. One is RTMS. It's non-invasive and uses magnetic pulses to stimulate specific brain areas. Then there's deep brain stimulation, or DBS, which is a surgical procedure. It's kind of like a pacemaker for the brain. Now, these are not first-line treatments by any means, but they offer real hope when nothing else has worked.
And as we look to the future, things get really exciting. The field is moving away from these broad labels and starting to map out individual symptom networks. They're figuring out which specific symptom, like one particular obsession, is driving all the others. This is the beginning of truly precise, personalized mental health care. So, let's just quickly wrap up the key takeaways. Number 1, OCD is often the driver, with depression following its lead. That means treatment has to prioritize OCD with proven therapies like ERP. But you can't just ignore the depression. You have to tackle the low mood and motivation to even get the ERP to work. And most importantly, for those who are struggling the most, please know that advanced options exist. There is always hope.
And that leaves us with one final thought to chew on. As we get better and better at mapping these symptom networks, at seeing the unique connections for each individual person, how might that completely change the future of mental health care? It's an amazing question, and it points to a future that is so much more precise and so much more hopeful.
Thank you for watching Cenario. If this video helped you, don't forget to like, subscribe, and share. For personalized mental wellness supplements, visit Cenario.com. See you in the next one.